Welcome to another Mentor Coronavirus question and answer session, and thank you for joining us today. The contents of this webinar do not purport to provide any financial investment or professional advice, and nothing in the content of this webinar shall be deemed to constitute the provision of financial, investment or other professional advice in any way. Our aim today is to focus our discussions around the practical considerations for businesses that have remained open, the types of actions businesses need to take when asking employees to undertake new roles, as well as reflecting on implications for businesses that have temporarily closed. I'm Helen Easton, and I'm joined this week by three of Mentor's specialists: Edwina Redhead for employment law, Keith McIlroy and Claire Frost for health and safety. All participants are on listen-only mode at the moment, but there is an option to ask questions within the Zoom application with the Q&A button at the bottom of your screens. We will attempt to answer as many of your questions as we can during this session. Our answers will be very general, but we'd ask you to contact us if you need very specific advice regarding your own business circumstances. So I'm going to start with a very open and general question to my health and safety specialist. And it's about whether or not businesses are actually allowed to be open and working at this time.
Good afternoon, Helen. I'll pick that one up. First of all, I'd like to say hello to everyone who's joined the webinar, and I hope you find this useful. The simple answer to this one is yes, but only if you fit in with the Public Health England guidelines. The government have provided clear guidance for all businesses and venues which must close, and have asked what that business do all they can to create the ability for employees to work from home. Where that isn't possible, they must follow the Public Health England requirements. For instance, on social distancing measures and washing of hands with soap and water for 20 seconds. It's the old stuff we've heard 100 times, but it's still very valid.
Thanks for that. But how can we actually implement and follow the Public Health England regulations within our businesses?
Afternoon, Helen. I'll take this one. So there's quite a lot of information out there to figure out and understand from the Public Health England how to manage it. The main things are review your work practice, the areas and the risks that are involved in your work, and then look at what you can do as a business to mitigate the coronavirus risk from spreading between your staff. So, for instance, that could be anything from one exit and one entrance. So you're no longer using just the same entrance that everybody goes in and out, to reduce the amount of passing of staff. Also, one of my clients are giving all their engineer staff on the workbenches their own tool belt. So what they do at the end of each day and the start of each day is go to their locker, get the tool belt out, give it a clean. They've got their own screwdrivers, their own scissors, their own small bits and pieces that they need. And then at the end of the day, clean it away and put it back in the locker. So that's a really good, sensible sort of solution to preventing crossover of tools. You could also look at, can you distance? It's not always practical, we know that with so many workplaces, but can you distance where your workforce are by the 2-metre rule? If you can, fantastic, do it. Also look, can you do a directional one-way direction within the premises, so you're not crossing over staff there? And also look, can you have hand gel points throughout that are easier? Make sure you give the guys and girls breaks to go and wash their hands regularly. Make sure that for definitely when they're eating their lunches, they're not all sat in that small canteen room that they used to. Stagger the breaks if you can, stagger where they're going, and do provide them with somewhere though to eat their lunch. You have to still give them suitable welfare facilities and rest break areas. So it's not a matter of just saying to them, we'll go sit out in the cold. They can't do that, but just make sure that you're doing as best you can, and also write it down what you're doing and let the staff know, make sure they know the new procedures.
That's good advice. Thanks, Claire. So building on that then, we're getting questions in about social distancing and specifically PPE. So what would the panel advise for further guidance regarding social distancing and also specifically around PPE?
Hi Helen, happy to take this one. Social distancing, there is loads and loads of information now. What I would recommend you do is go on to the gov.uk website. Under their guidance section, look for social distancing in the workplace during the coronavirus, and it gives sectors guidance. So you've got several different levels from you have retail, you have deliveries, you have manufacturing. There's lots and lots of suggestions. So please go on that. I'm sure you'll find it very useful and help you get along with the issues we've got around social distancing at the moment. PPE, again, it's still the same as far as things such as face masks. We've got the fact is World Health Organization is still only saying that it's for people in healthcare and the people who have the coronavirus. Will that change? Potentially. I mean, this morning, the Mayor of London was talking about people who's travelling on public transport to wear face masks. It's not yet in legislation, it's not yet government guidance. Again, the issue around that will be actually providing this type of PPE and getting enough, because with face masks, they will need to be changed regularly. So it's watch this space, I suppose, but we're expecting some more guidance around PPE, but it doesn't mean you mustn't stop wearing the current PPE you provide, such as footwear, high-vis jackets, goggles, gloves. It's all still there.
Thanks, Keith. I know we're starting to get some questions coming through about furlough, and we will cover more about furlough later on. But let's talk about businesses that have remained open at this moment in time. What if an employee doesn't want to attend work because they're afraid, because they, you know, maybe you can't guarantee them the social distancing? What would the panel advise in that circumstance?
Hi Helen, I'm happy to take that question, as I think that really does cover both HR and employment law and health and safety, and obviously thank you to everyone for joining today. So I think the first thing is, if employees generally are afraid, then do not dismiss their concerns. It's going to be really important for the employer to discuss with the employee what their fears are, and as Keith's mentioned, some of that may be able to be addressed through the measures that have already been implemented. So where Public Health England guidelines are being followed, that can be communicated to staff to help ease their concerns and hopefully alleviate some of their fears. But really having a conversation to understand what they're afraid of is going to be really key. I think, an important point to note, which, many business owners might not be aware of, is that employees are protected under the Employment Rights Act. So if they believe that they're in danger, and that's a reasonable belief, and they think that there is an imminent and serious threat of danger, then they do have the right to protect themselves. So really what this means in practice is that employers should tread very carefully if they're thinking of either dismissing somebody or disciplining somebody who's not turning up to work because they genuinely do have a fear or a worry that they may contract the coronavirus. So clearly speaking with staff is going to be really important, and agreeing a way forward. So whether that's using a period of unpaid leave or annual leave, they are all options, but certainly dismissing somebody, we would say, would be very high risk given the circumstances and the protection that's in place.
I'd just like to add to that, from a health and safety point of view, remember you do have a duty of care to all your staff. So as Edwina said, the key thing here is communication. Find out what their specific concerns are. Are you addressing them with your training, and are they covered in your risk assessment? Identify and explain how you're going to address these concerns within the business. This may be just showing them a risk assessment and talking them through the training they're going to be getting to help them work safely from home. But you really need to keep talking to them, because unfortunately people will start making up all their own concerns and issues. It may well be you are addressing those.
Okay, thanks, Keith. I think quite a few employers are concerned where we've got quite a few questions coming through about construction sites where you can't necessarily implement social distancing. But also another part to the question that I'm going to put to the panel now is, can we cover off something around construction sites, but B, can we also talk about businesses where workers are in contact with the public, and what would the panel recommend for implementing sort of best practices in those circumstances?
I'm happy to take that one, Helen, for you if you want. With regards to the construction sites, it is really, really difficult to social distance. There is a lot of work that you do on a construction site that is practically not possible to do social distancing with. The main thing is with construction sites, again, we sound like a broken record, but do it. Make sure what you're doing is essential. Now, when we say essential, is it going to delay that project? Is it a key part of that project that means that project can't continue? 9 times out of 10, you'll find it is, unfortunately, on a construction site. There's not a lot that you can't do from ground up that's not finishing, needs finishing to get to the next stage. In that case, what you should be doing is completing an individual risk assessment for that task where you can't do social distancing. So, for instance, if it's installing a roof beams or it's lifting in the plyboards, bits and pieces, whatever it is that you can't keep the 2 metre rule, then you should be following a risk assessment and just saying how you're managing that, whether you're managing that with PPE, whether you're managing that with certain shift change, how you're dealing with that, and whether you're breaking down the amount of time that those people are actually spending together. So try and, if you can, reduce the time. So it's not the best solution, but it is a solution to start with. Make sure on that site you've got welfare facilities where they can have clean hands, clean areas for their clothes. Make sure that they've got rest break areas. We've seen a lot of pictures recently where construction sites, they've still been squashed into those smaller porta cabin canteens. They're not suitable. If you have to have them on site, which sometimes it's restrictions of the budget of the site programme, try and stagger the breaks that the guys are having. And try and see if you can possibly reduce the amount of crew that you've got on site. It's not always practical, completely understand that, but maybe it might be worth looking at extending the project programme and reducing the amount of staff so that you can get a better social distance than having that programme still to that tight schedule of a year to complete, when you might be able to change that. Discuss with the client, because the client also has duties of care under the CDM regulations, so they're still responsible for certain items and certain care for your employees and anyone working on that project.
Okay, thanks, Claire.
Sorry, Helen, I'd just like to add to that as well. There's little things you can do when you've got 2 people carrying out a task which requires 2 people to, say, lift something. Just make sure they're not facing each other. Yeah, if they can do it by having their head turned, then if there is a cough or a sneeze, it's not going towards the person they're working with. There's plenty of little bits like that which you can do. It's a change of culture, and that's going to be the big issue here, I think.
It's good advice. Thanks for that. So let's come back to the employees again. We've talked about where businesses are working. And we get lots and lots of questions, and we get them coming through again now this morning about, look, what if we've got an employee who is either shielding or needs to be shielded? What can we do to help them?
Yeah, absolutely. And I think this is really relevant, as we know a lot of people have received shielding letters this week and are understandably feeling, very overwhelmed by, the direction that's in those letters. So in terms of what the employer can do, absolutely, being there to support the employee, really speaking to them and understanding how they might be feeling at the moment. Practically, anyone who's advised to shield, the employer can furlough those individuals for 12 weeks. And anyone who is caring for somebody who is shielding, again, the updated guidance that we've received this week has clarified that they can also be furloughed as well. So we have had some updates to this, but we recognise lots of people will be, dealing with this week as letters are still coming out to individuals, and that can feel quite overwhelming. So I think the key thing is just to keep making sure that you're in contact with all of your staff that this applies to, and just being there to support them as much as possible.
And what about, Edwina, the employees who've got childcare responsibilities who can't come to work because nurseries are still closed?
Yeah, absolutely. So again, this has moved on slightly since our last webinar. So if anyone's joined from our last time, there is a slight update to this. So the guidance now clarifies that anybody who is unable to work due to caring responsibilities, which includes anybody who, you know, is unable to work due to childcare because the schools are shut, they can also be furloughed. So this has widened the scheme. Previously, we believed those employees wouldn't be eligible if there was work available to complete, but we have had clarification that those with caring responsibilities can be furloughed. So that is an option that's available to the employer to help support those staff who feel that they're obviously unable to complete any work due to their caring responsibilities.
Okay, thanks. Now, I almost want to go backwards a little bit and be a little bit more general. What about if we've got employees who are afraid to come to work?
Yeah, I think this is going to just continue to be an issue actually as the weeks go on and more people are contracting the virus. There are going to be more and more people that, you know, are indeed afraid of coming in. And I think, you know, we have touched on this already, where it's going to, the first step is always for the employer to try and alleviate those concerns by having a conversation explaining the steps that they're already taking to help, you know, support that individual and to protect safety. So having that conversation first of all, but I think this is going to be something that we see more and more of as obviously more people do fall ill over the coming weeks, and the chances of contracting the virus again, you know, increase if you are still going into work and coming into contact with other people. So really clarifying the steps that you are taking, making sure that the safety of your staff and for anyone else visiting your premises is paramount, and just keep communicating those action points.
I'll just add to that, Helen, if I can. Also, just thinking it back at the beginning of this year, before all of this kicked off, the main focus going forward for the health and safety was on well-being of employees. A long time it's been safety, 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 and all of a sudden they've realised health is crucial to making sure that your staff are still performing and productive and in a safe manner. And that goes down to their wellbeing mental side of this issues, because obviously this is a frightening time for a lot of people. And as Edwina said, as more and more people get infected by this, it's going to get a lot closer to home. So the more closer to home it gets, the more people are going to start being more anxious. And the main thing is communication. Just make sure you're communicating with your staff constantly. And that might just be asking them, how are you? And that's all you need to do, is just, you know, constantly reiterate what you're doing, why you're doing it, and just make sure you keep up with that training. It might be just a toolbox talk that you have once a week with your employees, just to say, you know, we've put this new hand gel in here, or we've made sure that we've put the new co-op, for instance, have put new screens up like the rest of the shops have done for their cashiers to make them feel more secure. So just look at what you are doing and what you can do, because you do have a responsibility under health and safety for the health of your employees, not just the safety, and that will be something that will just go forward with time. This isn't going to stop. This is just going to be a new way of working, so do implement it as soon as you can.
I'll just add to that exactly what Claire and Edwina have said. It's spot on, but just make sure you address their specific concerns. If we just generalise, sometimes they feel that we're fobbing them off. So you need to find out exactly what their problems are and explain how you're addressing those concerns within the business.
Thanks, Keith. Thanks, panel. All right, we've talked about businesses that are continuing work as normal, but we've all, I think, in our work come across businesses that have started to adapt. So, panel, would you like to share some examples that you've seen where businesses have actually changed what they're doing in order to accommodate coronavirus?
And I just think there's been so many examples. So I'm happy to kick off and just share a couple that I've seen from the businesses that, you know, I've been speaking to over recent weeks. So I'm aware of a number of plastic companies that we support. They're currently pivoting their business to be able to produce parts for ventilators. Again, a lot of clothing and retail companies are, you know, getting the patterns to make scrubs and other protective equipment that the NHS might need. A lot of alcohol companies are obviously turning their hand to mass producing hand sanitizer. So we are aware of a lot of businesses locally that are also contributing to the efforts. It's not just the big businesses that we hear of in the news. Another local company that I was speaking to is actually quite far forward with antibody testing, which is just unbelievable, given how quickly they've had to change the business in the last couple of weeks. But I think, you know, even on some practical terms, I am aware of a bakery which unfortunately has needed to cease trading, but that hasn't stopped them being able to, you know, really engage with their community and their customers. They've actually turned to doing a series of bake-along lives on the internet where people can join in, follow the recipes, create baked goods from home. And I think it's a really interesting step, that whilst the business isn't, you know, actually mass producing those baked items anymore, they're really encouraging people to get involved and take part. And what that's doing is it's building brand loyalty, it's building engagement, and actually it's going to serve them really well when we come out of the other side, where actually they've got a really loyal and engaged following who feel that they've been part of the journey. So I think there's lots of things that businesses can do to really speak to what their customers need right now, or what society needs right now. So it is just a case of bearing that in mind and adapting as much as possible. But I'm sure there are other examples. Claire and Keith, I'm not sure if you've got any others you want to share.
Yeah, I've got one, Edwina. One of my clients, I'll firstly say I'm so impressed with all of our clients and how so many of them have done so well to pivot and adapt so quickly in such difficult times. So it's really positive to see that there are ways of adapting and developing in these awful times. One of my clients, they're engineering, and obviously, like many people, their workload and portfolio has decreased, but they still have work to do. Therefore, they've had to decrease the workforce to manage this, because obviously they can't keep everybody on. So they furloughed a large majority of the engineers and got a very small skeleton crew. And my client was, like many others of my clients I've spoken to, really concerned about the welfare of these guys having burnout from working too hard, too many hours, where it's only this small crew, which I really find admirable for so many of my customers being that sort of caring about their employees' welfare. So what this client decided to do was implement a 3-on 3-off shift. So basically the engineers can have 3 weeks working and then 3 weeks off, and she will bring in a team that have been furloughed onto that 3 weeks off while that other team is furloughed, enabling them to get a nice rest. And I think one of the guys said he's just looking forward to having a beer, which, fair enough, we're not saying he's an alcoholic, but at least he's saying he's getting his downtime, and that's the main thing. And I thought that was a really good idea.
I'd just like to add one on to that, and that is, one of my clients is a restaurant in central London, and 95% of their trade was walk-in, very little takeaway. So obviously they've tried to develop the takeaway side, but they've also now started to do 300 meals a day to the NHS, which I think is a lovely thing to do. And also they're supplying from where they are places such as St Thomas's. So it could well be that Boris Johnson had one of their meals recently. But it's just that attitude. It's all proactive. They took a bit of a blow, took a backward step, and thought, how can we move on? And they've been absolutely brilliant.
Thanks, panel. And something that's come out of all of those is people are thinking about not only adaptation, but they're also thinking about their reputation, because I think when we come out the other end of this, I think reputation is going to be key. So thinking about those businesses that have adapted, what actions would you think that they need to consider when asking employees to undertake new or different roles?
Absolutely, I'm happy to kick this one off. So I think, you know, the first point is actually, you know, what are we asking people to do here? And actually, are we asking people to undertake something new or something different on a temporary or permanent basis? Actually understanding what is required, I think, is going to be the first step. Now, if that is broadly similar to what the employee was already doing, there shouldn't be too many challenges there. But if we were asking somebody to do something that's completely different, then I think we do need to be mindful of that. And I would certainly encourage anybody who has joined the webinar today, if that applies to you, then just to seek advice in relation to your specific circumstances, because if we're asking somebody to permanently do something that's very, very different, then we just want to be aware of any employment law or redundancy implications there. I think the second point is just to make sure that people are equipped where we are pivoting so rapidly and you know, the focus of the business direction is changing. Actually have people, you know, have they had adequate training to deliver what is now expected of them? So really ensuring that the people know what it is that they're supposed to be doing and they are equipped to be able to do that. So I think they're probably the biggest considerations. I don't know if Keith, maybe you've got anything else to add from a health and safety standpoint.
Yeah, thanks, Edwina. Really, just to reiterate what Edwina's been saying, I mean, consider the training required to carry out that new role safely, safely being the key word. Do you need to provide different PPE to what you've got, or existing PPE which this person may not have had to use in the past? Consider if the employee is fit enough to carry out the new task. For example, if you're asking them to do additional manual handling, yeah, are they physically fit to do that? So you need to consider what that person can do, and rather than just do a blanket new job role and just talk back into that person can do this and someone else can do that. So just think about who's doing the role and apply it to the right person.
Okay, I've got a couple of supplementary questions, actually, if you don't mind, to that. So, for example, how can we support our staff where we're doing a two-man or more delivery situation where they have to work together? What's your advice on that basis?
I'm happy to kick that one off, Helen. First things first, have a look and risk assess the job. Have a look at the tasks they're doing and ask yourself, is it essential? Is it really necessary? And not just from a business point of view, but also from an ethical and moral point of view. Obviously, you've got to look at these all in one. This is what the government's asking you. This is why it gets quite confusing when they say, is it essential? The main thing is you've got to prove that you can do it safely. If the answer is no, then can you just put that off for a little bit? Can you postpone that until either the lockdown, certain items are lifted and we can reassess it from there and assess whether we can do it again, or can you hold until things are a lot better place? If you can still do it safely, then look at how you're doing it. Do you have to use two men for the job, or could you possibly use some equipment to help, like a lift, a trolley, a dolly, something like that? If you can't, then just look at how the guys are doing it, whether they need some additional gloves or continual disposable gloves, because obviously they are only one-use wear gloves. Not like I've seen in the supermarkets where people are pulling them off with their fingers. They are constant one-use wear, bin them, don't use them again. Give them hand sanitizers in the vans to make sure that they're on the vehicles, to make sure they've got those. And also take leads from people like Hermes, DPD, there are other people out there, but use those. I don't know, we've all probably had a few deliveries from them recently. They drop off at the door, they will ring the doorbell, step back, take a photo of the door open and the delivery, and that's their contactless delivery. So it's a really good way to do it. Can you ask your customers to come and do delivery and collection, which is distance, rather than your guys having to go deliver? There's quite a few solutions that you could think of doing, and it's just making sure you've assessed it, what they're going to come into contact with, who they're going to come into contact with, and how, and then look at how you can prevent multiple risks.
Thanks for that. Can I add one question in? So we've talked about adapting, we've talked about what people can do. Having done all this adaptation, and we know that an awful lot of businesses have asked people to work from home, when all this is over, what's the legal implications around what if staff say, well, look, you know, you let me work from home, or you let me do something different during the COVID-19 outbreak. I want to continue doing that going forward. What's the legal position there?
So what employees would want to do if they're wanting to request to work from home permanently, for example, they would need to go through a formal flexible working request to see if that, you know, request can be accommodated on a permanent basis. And I think actually, you know, the circumstances that we find ourselves in at the moment will actually, you know, encourage us to challenge our thinking around, you know, can roles that we previously thought, you know, were not possible to conduct outside of the workplace, you know, can they now be conducted from home? Have we actually, some of those barriers that we thought were there previously, have we been able to overcome some of those? So the answer to the question would be to, you know, if an employee wanted a permanent contractual change, they would go through the formal flexible work process in the normal way, but the employer would need to consider whether, you know, it would be possible to allow that on a permanent basis. And there may well be some good reasons why, you know, that should be accommodated, but clearly it will be for that process to decide.
Thanks for that. So look, some businesses have been doing really well, or maybe, you know, that they haven't necessarily been able to flex as much as others, but they've had to take in new or temporary staff to cover the work that's there. From an employer's perspective, what are their responsibilities for these new and temporary staff?
I'll take up this from the health and safety perspective. First of all, remember, you need to treat both permanent and temporary members of staff the same. So you don't two-tier this, everyone gets the same. You need to scope the new roles to identify that the requirements of the new job are clear, and so that you can then risk assess them properly and identify any potential safety issues for that role. I would also say you need to train the staff to reduce or remove the possibility of injury. Monitor that the staff are undertaking these new duties as identified in the risk assessment, and applying the training required. And quite often we just say to someone, this is how you do it, and we don't check on to make sure that is how they're doing it, and that could leave you open to potential claim going forward. Listen to staff's comments regarding any improvements, and record any changes you make. Again, key to make sure you make notes of every change you make. Training records are also essential. I would recommend you utilise the e-learning system or Mentor Learn to get the employees trained. That keeps a record for you as well. And in these times, it can give you a structure. So make a training matrix. You want your staff to cover these modules in a particular time. Also, I would say you need to carry out a health questionnaire. Get all new employees to complete a health questionnaire before they start. Have a look and see if there's any issues you wasn't aware of. Ensure they're aware of your current protocols for what to do if they or anyone else in the household has symptoms of the coronavirus. And basically share the risk assessment for the role and as a safe system of work for that task. I'd also add, just briefly at the end, be aware that a lot of things such as social distancing will not go away immediately. We stop self-isolating. I think that you'll find that it could be the new way of working for a while anyway, especially until they know that this virus has gone and we've got systems in place to stop it spreading. So when you look at these things, don't look at them as a short-term fix. Look at them as a change of culture to your business.
Thanks for that, Keith. You know, I'm a manager, and we've had quite a few questions on this topic. You know, if you're managing a number of employees during this situation, but you know what, we're all finding it quite challenging. You know, are people pulling their weight? You know, are things working? And actually having to deal with people's worries and anxieties. What suggestions have the panel got to help out in these circumstances?
Yeah, I think it's a really relevant question, and I think particularly for managers who are finding themselves remote managing teams for the first time, It can be extremely challenging where, you know, you're not physically with that person in the same way that, you know, you otherwise would be if you were at the company premises together. We have touched on this a little bit in previous webinars, but I think, again, really setting up people for success. So making sure that they know what is expected from them, that you've set clear objectives. It's likely that that is going to have shifted from the start of the year. So whatever it is that people are supposed to be doing at the moment, are they really clear on that? I think actually just setting some really clear working parameters as well, whilst, you know, more and more people are working from home, that obviously affords a lot of flexibility, which is great, and people can really start to balance, you know, other caring responsibilities that they have, but be really mindful that you are setting some parameters even with your flexibility, so you know what people are doing and when they're doing it. That helps you to ensure that, you know, the customer demand is being met, but also that people's well-being is protected, that they're not working really excessive, you know, long hours, and actually they are getting a bit of a break, because when working from home, those work and home boundaries can become quite blurred. So I think just yes, having some best practice guidance for, you know, your working situation at the moment will be really important. I think keep communicating with people, particularly where you are, you know, managing teams remotely. People can start to feel quite isolated quite quickly. So having a really clear communication strategy, thinking about things like, actually, would doubling the frequency of communication but halving the duration, would that work better for you to help ensure that people are feeling connected and really aligned to, you know, what the objectives are at the moment? And I think also just being mindful of the situation that we're in. People are going to be feeling different emotions at different times. Again, as you know, more and more people contract the virus and it's affecting you know, more of us personally. Actually, you know, how can we really make sure that we're supporting people with their well-being and really ensuring that the morale is staying as high as possible, as perhaps the novelty of the first few weeks of lockdown has worn off, and actually we're starting to get into a more new normal stride. So I think there's certainly lots of things that managers can think of, and I would just encourage anybody who's listening who wants to maybe see some further tips and guidance on this to log on to Mentor Live in the Coronavirus Hub. We do have some tips and guidance for managing teams remotely. So if anybody is finding this a challenge, that might be a good place just to get some further guidance.
Thanks.
If I could just add to that, Helen, just one simple thing, just make sure your managers have got training to be able to support themselves through this as well. It might, Mentor Live, Mentor, for instance, have lots of e-learning modules and bits and pieces for managers to do, and training with regards to empathy, managing staff. That might help them. If they haven't got the right training behind them already, they are a new member of management, for instance, that only started a few months back and now they're swimming like a swan on top and paddling madly underneath. See if they've got the right training and if they need some support, and that'll just help give them the confidence to manage their team.
Thanks for that, Claire. You mentioned training, actually. Let's go back slightly from a health and safety perspective. We've got lots of pieces of training that are very time specific and qualifications expire and need to be renewed. What happens if we've got that going on during this current sort of, you know, the next sort of 2 or 3 months? What happens if that expires and we can't actually get the training done again?
I'll take that one, Helen. First of all, we've said it many times, I can only reiterate, make notes. Make sure that your records are available. That's the key thing here. So be able to prove that you've taken all measures to try and get the training done, and record how and why this cannot be done at this time. Review if the job is necessary, or can this be put off on hold until such time as the employee can be trained. Again, record that. If, for instance, first aid is due to run out, and you can be given a 3-month extension on this for such training as the Emergency First Aid at Work certificate, go to the Health and Safety Executive website. It has a link to what training is available for extension, and there's lots on there. Much too many to go through at the moment, but please visit that. So that's the Health and Safety Executive website. If it's required, complete a risk assessment and record how this can be carried out safely without the training in date. And you may well be able to do that. And finally, utilise competency-based training for the interim period. Make sure you can clearly demonstrate how that person is competent. It might be through the number of years they've done the job safely. It may be that they're already used to do toolbox talks on site. But there are ways around this at the moment. But if you must have the training and you can't cover it, then you really can't carry out that job safely.
Thanks, Keith. I want to move now to businesses that have had to close temporarily. So panel, what do I need to think about as a business owner where I have had to close up?
I'm happy to take this from a health and safety point of view, Helen. So it is really crucial that you still manage the safety of the premises. Even if you're not in that premises, you have a responsibility for that building, for managing it. So there's a few things that you could do. For instance, just make sure that before you leave that final day that your alarm systems are all working, the fire alarm systems are working. Make sure that the premises outside are clear and tidy. That's a really key thing to do. It's an arsonist's dream if there's loads of pile of waste up around there. So just make sure that the whole area is clean. And make sure if you can, in this moment of time, we know it's not possible, but get a security guard to patrol the premises, especially if you've got any high risk items in there, highly flammable goods in there. Obviously, we know at the moment that's quite difficult for some companies. If you can't, go there regularly and inspect the building. We would always recommend that anyway, that you have some sort of program in place that someone goes and inspects that building to make sure that it's still safe, secure. Oh, and also let your insurances know. If you don't let your insurances know that the building is not being occupied, it could affect your insurance. So do make sure you let them know.
Thanks, Claire. Edwina, have you got anything to add to that at all?
I think just obviously whilst your premises are closed, it's likely that your employees are either working from home or they've been furloughed. So if they are if they're not working, I think just making sure that you've got basic things like your contact information for staff up to date. So if you do need to get hold of everybody, you are able to do that. And I think it's really just again the theme of the conversation today. Focusing on what you can do. So if employees are not they're not working, they're not able to complete any work from home, and perhaps they have been placed on furlough, although they can't work, can they take up any training? Can you focus on upskilling people in this time and really using the opportunity to make sure that you are in as strong a position as possible when you come back? So I think just again focusing on what you can do rather than what you can't do is a good consideration if businesses have needed to temporarily close.
Thanks, Edwina. So look, I want to focus finally on furlough, and rather to go into too much detail, I think, Edwina, I'm going to ask you a very general question, but I know that there have been some updates in the last couple of weeks. So when will the furlough grant become available for us?
Yes, I know a lot of businesses are really waiting for this. They really need these grants to come through now. So we have had confirmation this week that the portal is going live on the 20th of April. So that's 3 days' time. And the employees can prepare themselves by having a look online and just seeing what information they need to submit their application for grants under the government's job retention scheme. So all of that information as to what employers will need, that is online, so they can start to prepare themselves. And we are expecting payments to be made within 6 working days. So that's good news for many employers who are, desperately waiting for the grants to become available. An update since our last webinar, and quite a big update actually, is that more people are now eligible to be furloughed. Previously the cut-off date was the 28th of February, but that's now been extended to the 19th of March. So that's really just to capture anyone who may have changed jobs in that time. They can still be furloughed. So this is a really big update. If you had any of those recent joiners who you previously thought you weren't going to be able to furlough, it's likely that as long as they started before the 19th and payroll information was submitted, that they will be eligible under the scheme, which is good news for many employers.
Thanks for that, Edwina. Now, just remind me, does the grant cover bonus and commission payments?
Again, so we've had some updated information on that this week. So anything that's a discretionary bonus or commission, that is excluded. But any past overtime or regular compulsory commission payments, they can be included. So if somebody has contractual provisions in place for commission or for overtime, that can be included, and the employer would need to use the variable hours calculation if that obviously applies. I think just to add on to that, one of the other key changes, which I just really want to stress because it affects so many people, is the notification requirement. Previously, employers just needed to notify an employee that they were going to be placed on furlough, and that would be sufficient. The requirement has actually changed, and it's slightly more stringent now, where actually agreement has to be reached. It needs to be in writing, and it must clarify that the employee will not do any work whatsoever for the employer whilst on furlough. That needs to be agreed, it needs to be signed, and a record needs to be kept, and that is to prevent any fraudulent claims being made under the scheme. So if you previously sent a letter notifying staff that you were going to place them on furlough, just be aware that that now may not be sufficient, and actually you might need to revisit that to update your documents to make sure that you've got that in place, because HMRC are reserving the right to retrospectively audit any grants that have been paid out, and you certainly don't want to be in a position where you're caught and potentially having to pay back some of the grants that have been paid out to you. So just, yes, a word of caution there that those written requirements are going to be very important.
Okay, and something that a number of questions that have just come through is, where's the best place to go for advice on where to find the portal and the sort of advice that we're talking about?
Absolutely. So the government website, that's where all of the updated information, can be found. I'm sure we'll be able to send a link out, after this webinar, just so that that's quick and easy reference for people. But that would be the source of information that we would recommend people are staying up to date with.
Okay, thank you very much indeed. And finally, a question about annual leave, because I believe that's changed or the guidance has become a little bit clearer. So can people take annual leave whilst they're on furlough? What are the rules? Can you give us a bit of an explanation, Edwina?
Yes, obviously very topical. We've just come out of a long weekend. Many people will have been taking holiday. The guidance here is that if people are taking holiday whilst furloughed, the employer does need to pay them their normal day's pay for the days that they have taken holiday. We've also had clarification that the working time regulations have been relaxed. So what that means is that if employees are unable to take their annual leave due to the coronavirus, either they've personally been affected or the employee's been affected, which has meant they're unable to take it, then up to 4 weeks of leave can be carried over. But that being said, we would really encourage businesses where possible to manage annual leave and ensure that that is still being taken wherever possible, so there aren't lots and lots of days of leave rolling over that still need to be taken. So obviously where it can be, we would encourage staff to still take that, but obviously if they're unable to, there is now the provision that some of that leave can be carried over.
Okay, thanks. Look, we've covered as many questions as we possibly can today, and I have got hundreds that have been posted through the Q&A function. So first of all, I want to thank you all so much for your engagement and your participation. At this point, I usually summarise the key points that we've covered, and today it feels appropriate to highlight Edwina's comments around adaptation and discovering the art of the possible within your business, but along with that, to talk about Keith and Claire's valuable advice to review your working practices regularly, record them, and most importantly of all, covering either area that we specialise in, to communicate to your staff. I'd encourage everybody to keep referring to the Mentor website, where you'll find the most frequently asked questions. And for our existing clients, please do log into your Mentor Live account and check on the coronavirus hub that we've got there. It's got templates, letters, so many other resources to help you. And this week alone has been updated with over 20 different items, templates, all of that. It's also got the registration links to our next session, where we will cover more about furlough and possibly redundancy as well to help out. So for everybody who has registered on today's webinar, there will be a follow-up email coming to you shortly that will guide you to our website. And by clicking on the coronavirus Q&A read more tab, it will enable you to register to use Mentor Live at no charge. If we haven't answered your question today because you've got some very specific circumstances, please do contact us. The details of how to do so are on our website. I'd like to thank our panelists for sharing their knowledge, and most importantly today, I would like to thank all of you for joining us.